Okay, House of Pod. We are here. We're House of Pod, is what I'm trying to say. We're House of Pod. You are people watching this. I'm Kaveh.
I'm Lizzie.
And this is our good friend, Umang Mehta.
Hi.
Dr. Mehta to you
Thanks for having
folks.
me.
From Mehta Plastic Surgery in Atherton, California. Instagram handle, at Mehta Plastic Surgery. That's MEHTA. Plastic surgery, you guys should be able to figure out. Lizzie and I had a couple of things we wanted to talk to Dr. Mehta about. And particularly, we kind of wanted to go over plastic surgery that we've seen done in famous people. And we didn't want to make this about shaming people for plastic surgery. And at some point, we can talk about the weird pressures that Hollywood places on these famous people to look younger and all that. But we kind of just wanted to know what's happened. Because when you look at some of these people, you look at some famous people who've had work, and you know they've done something, but you may not necessarily know exactly what it was. That's what we wanted to do today. So who do we got up here first?
I will preface it. We're not going to go into the history of Hollywood or the culture of Hollywood because we don't really know. But there is something to say for people who live their lives on TV and are in the pictures, in the pictures, the good old days,
in the movie biz.
moving pictures, the talkies now. I think there's something to say for that. They're specifically in a job culture where they're being judged, and it's not okay. Sort of it is. I mean, we're supposed to judge them based on their looks. We're putting them on stage and on TV based on certain characteristics, physical characteristics. So I don't feel so bad about it. Anyway, so we're gonna.
I feel a little bad about it.
So the first one's obviously going to be the Kardashians. Well, this is Kylie Jenner. So she's the youngest and the richest, and maybe you could arguably the most sort of. Successful right now based on money and stuff, and that's a picture of when I think she was like 15 and this is now, and I think she's like 20, and I totally could be wrong. So we're going to ask our expert Umang Mehta to tell us what she's had done. And again, she's beautiful here and here, so there's really, I don't think this is super toxic. So
Umang,
Sure.
Taking a look at these pictures here.
Yeah, so I think if we take a look at the photo on the left to the photo on the right, I think the thing you can clearly see is that her nose is more refined in the photo on the right than the photo on the left. So that appears to be a rhinoplasty that she's had, and I think it's overall done very well. It's a very natural appearance, a nice feminine looking nose. Kylie's very well known for her lips, and I believe she's publicly talked about lip augmentation. So there are a lot of fillers that are used for lip augmentation, like Restylane, Juvederm, Volure. There are a variety of products that are what we call hyaluronic acid fillers that help to augment the lips temporarily. There are also surgeries to augment the lips in which implants are placed in the lips. It's hard to know which she had, but I would suspect probably the former. The hyaluronic acid fillers are definitely much more common than lip implants. If we look at her cheekbones, she has very nicely defined cheekbones. This could be the result of filler or, again, possibly implants, although I would suspect filler.
That's something that would just be done like a clinic, or is that something that she would need to go under the knife for?
No, filler's done, it's a 5-10 minute procedure in the office without any anesthesia. With ice and numbing cream, it's actually fairly painless. Yeah, we have time this afternoon if you're interested, Kaveh.
you're so nice. You're like, Kylie's spoken about it publicly, so I can. Or you can just use your eyes and look at the difference between her lips here and here. I mean, it's just, it's fine. I feel like just people maybe should own it a little bit more.
Totally.
Especially you're young and beautiful here, and you're young and beautiful there. Let's do it.
Yeah, we're not judging her for this.
Absolutely
You
not.
are.
No.
I think you said it right. I mean, she looks good in both pictures. She chose to look a certain way. As long as that is not putting her in any real health risk, I got no issue with it.
No,
so
and I think
do what you want to do.
In my industry too, there's definitely been an uptick in younger patients seeking specifically lip filler, and patients will often show me a photo of Kylie Jenner and say, I would like my lips to look like her. So there's definitely been a Kylie effect kind of across the industry in terms of lip filler becoming more popular and seeking a certain look. I think the key is to keep it natural. So the problem is that sometimes patients are, come in seeking lip augmentation, and then somebody who only needs one syringe, the doctor may sell them 2 or 3, and then they look like ducks. Or if it's done improperly, where it's put all in the upper lip, not in the lower lip, or put too high, or
What do you do? Are you in these weird situations sometimes where like a patient
that.
comes to you with having some work that was not great,
Right.
and you know it's not great, but you don't strike me as the kind of doctor who wants to talk shit about other doctors. So
I mean, I think you have to be objective, though. Like, if the patients come in and they're asking me for my professional opinion,
yeah,
I'll let them know that, to me, in my opinion, I feel that your upper lip is a little fuller than your lower, so let's dissolve some of the filler from the upper lip, or let's give it 6 months or a year, come back as your filler's worn off. Luckily, most of this stuff is reversible and temporary, so if somebody's had work done that wasn't done well, or, I try to keep it very objective, because they're coming in not for me necessarily to sugarcoat things, but for my professional opinion.
Yeah.
And so I think as long as it's presented in a way that's positive and constructive, and here are the solutions. Even sometimes the solution is just let's wait it out, or
I didn't know you could dissolve it.
you can absolutely.
great, man. Well, thank you so much. Remember, Mehta Plastic Surgery in Atherton, California, at Mehta Plastic Surgery. That's MEHTA Plastic Surgery. You should know how to spell it at this point. And thanks for coming on, buddy.
Hey, thanks for having me. That was a blast. Thanks, Lizzie. Thanks.
Thanks.
Kaveh.
I'm going down a Hollywood rabbit hole now with plastic surgery. Sorry. Totally.
Bye.